So, what to learn to unlearn today? Hello, everyone. Welcome on the Healthy Podcast. I'm really happy today to introduce Dr. Shivika. Hi, Dr. Shivika.
Hello, Ingrid. How are you doing?
Very
Great to be
great.
here.
Thank you. Great to welcome you today.
Thank you. Likewise.
Dr. Shivika, you are a seasoned mental health expert based in India, and you are known for your holistic and integrative approach to psychological well-being. You have more than a decade of experience combining your deep theoretical knowledge with practical insight drawn from your work in clinical psychology, neurolinguistic programming, CBT, which is behavioral therapies, SFBT, trained couple counselor, also trauma therapy, and much more that we will discuss further. You are also the founder and chief psychotherapist of Manostiti, which is a registered mental health, wellness, and support venture. Your area of expertise are quite broad and include OCD, PTSD, ADHD, eating disorder, addiction, personality disorder, and adolescent and couples counseling. You have a PhD in social science from the University of Rajasthan and also a master in clinical psychology. So you are also fluent in English, Hindi, Punjabi, and French, making your therapeutic approach not only evidence based but also culturally attuned. Beyond your practical clinical practice, you conduct a lot of workshops for professional and individuals alike, offering compassionate, tailored support. Last but not least, you contribute actively to academic discourse as an editorial board member of the UGC Care Listed Journal, and several of your research explore contemporary themes such as the impact of online learning on student well-being, the role of AI in mental health, which is really topical currently. I hope I did not miss anything. So thank you again.
No, in fact, I think you have covered more than that. So wonderful. Thank you so much, Ingrid, for that wonderful introduction.
Thank you, Dr. Shivika. I was wondering if, let's say, I have anxiety, depression, I'm not taking medication, how would you know which therapy is best suited for me? And is there actually any specific practice to implement with the client who may go through those hurdles?
Okay. So since you are talking about majorly about
Depression.
anxiety and depression, as I just said, it's it's not one therapy for all. Also, a person may start with a certain therapy. For example, let's say if you're talking about anxiety or even depression, we may start with psychotherapy or maybe even CBT. But we may realize, okay, as of now, here and now solutions are required more for him or her to, function effectively in the daily life. We may go towards SFBT and then come back to CBT or maybe psychotherapy as the person stabilizes or when the short-term therapy starts to work, then we can come to a longer process or procedure. So it is not a one fit all. We have to see the situation the person is in, the circumstances the person is in, the personality of the person. Very, very important. So there are some people who want, quick solutions. Listen, I don't want to delve into the past, but what can I do with my present? How can I deal with that? Can you help me with that? So, okay, so we'll focus on that. If that is your priority. So we try and go according to what patient needs at that point of time, and slowly explore the other areas. As and when the patient gets comfortable in sharing, because initially everybody does not open up that easily. It takes time to form that trust. As and when that trust is formed, the patient also feels comfortable. Okay, I feel there is something much deeper than what is superficially visible. So that's the point where we pick. Okay, since you have felt that, so let's delve into that now. So that's how we, take the approach. Different therapies can work for a same person at one point of time, and at times only one therapy can be required to resolve a certain specific issue.
really aware what is exactly aromatherapy, neurolinguistic programming, CBT, SFBT, and DBT, if I forgot any. So that would be great to have a better understanding of those terms.
Let's start with NLP. So NLP stands for Neurolinguistic Programming. It's a cognitive reframing and behavioral change. So we try and reframe the thoughts with assertive thought pattern, okay, affirmations, use affirmations in there, and help the person to put that in practice. So that would be the behavioral output. So that's a very, very brief about your neuro linguistic programming. Then let's come to the CBT, very, very famous. We all practice it. CBT stands for cognitive behavior therapy. So it is more about, targeting or focusing on the thought pattern of the person and the beliefs and the resultant action of it. So what is the activating event which led to a certain thought pattern? It could be a negative thought pattern, which one is trying to work on. Okay. And then we actually try and make the person see the sense of it, whether this particular thought is actually helping him or her in any way, or it is leading to discomfort. So when a person says, no, it's not doing any good for me, if you're constantly thinking in a negative frame of mind, or a faulty thought pattern that you have, and it is not helping you in any way. So let's say you keep saying, oh, I have not studied that hard, I'll not do well. Last time also in this paper, I did not do well. So this time also, I'll not do well. This paper is always tough. So that's a thought pattern which is not yielding any kind of positive results anyway. So let's discard it. Let's try and discard it with a more positive reframing again, and then putting that in the resultant behavior. Fine, the subject is a little tough for me. What can I do to improve myself? What options do I have? That's you are moving towards a more, I would say, positive area of work instead of just cribbing about it. So that would be a brief about your CBT. Then we come to the SFBT, that is your solution focused brief therapy. That's the full form of it. Now it is more goal oriented, here and now. There are certain issues or certain problems which needs immediate solutions, where you do not have the time or the energy to delve into the past too much, or maybe at times that is too traumatic for you. So we need to find certain solutions for that. So it is more, goal oriented, short term solutions. What can be done? Okay, this is my present circumstance. What can I do? What options do we have? So we target on the best possible and suitable option at that point of time. So that's about your SFBT. Now we have the DBT. As I said, it is more about regulating the emotion, the faulty patterns of the emotion, increasing mindfulness. That is also one aspect that we use it here. And now, as I say, mindfulness itself is a form of a therapy that we use. Mindfulness is nothing but being observant about the phenomena happening around you and within your own self, in terms of the thoughts, in terms of the actions. So that when you, as we say, when you look a little bit within or realize those things which are not working well for you, then you can, emotional dysregulation that you can try and work towards. So that's your dialectical behavior therapy. Again, it is more here and now solution focused, okay, in a short term therapy. So I strive to help my patient regain their self confidence and motivation. I think that's really good for them. Once that is there, a lot of things can be counted.
Thank you so much again, Dr. Shivika. It was such really enlightening discussion about the huge arena about mental health, mental wellness, and all the techniques which exist and that you're mastering. You can see your profile on the Vhealthy page. I encourage everyone to check deeper your page as well and all your publications, etc. Merci beaucoup encore une fois.
Toi aussi, merci beaucoup.